The bones involving the lateral view or the norma lateralis of the skull involves both viscerocranium, the facial bones, and the neurocranium. The bones involving are the maxilla, the mandible, which is removed here, the nasal, the lacrimal plates, the frontal, the zygomatic, sphenoid, parietal, the inferior superior temporal lines forming the parietal eminence, the squamous part of the temporal bone, zygomatic arch, the mastoid process of the temporal bone, the external acoustic meatus, and the styloid process of the temporal bone, the occipital. Now, the sutures. Maxillozygomatic suture, zygomatic-facial foramen, the parietal bone is separated from the frontal bone by the coronal suture. The parietal bone is separated from the mastoid part of the temporal bone by the parietal mastoid suture. The parietal bone is separated from the occipital bone by the lambdoid suture. The occipital bone is separated from the mastoid part of the temporal bone by the occipital mastoid suture. The zygomatic process of the temporal bone forms the zygomatic arch, which continues posteriorly to form the supramastoid crust. With the superior and inferior temporal lines, forming the superior and the posterior boundary of the temporal fossa or the temporalis muscle. The anterior boundary is formed by the zygomatic bone, and the inferior one forms the zygomatic arch. The triangle, called the suprameatal triangle or the McEwan's triangle. Superiorly, it is bounded by the supramastoid crust, the posterior continuation of the zygomatic arch. Posteriorly, it is bounded by the vertical tangent drawn to the posterior of the external acoustic meatus, and anteriorly by the external acoustic meatus. The H-shaped meeting point of the sutures, called the Pterion. It joins the four bones, frontal, parietal, temporal, and the sphenoidal. It is clinically significant. Any damage to this site can cause a rupture of the anterior division of the medial meningeal artery, causing the epidural hemorrhage, causing the paralysis of the opposite side of the body. The McEwan's triangle is also clinically important for the mastectomy. The Pterion is a star-shaped meeting point of the three sutures: the parietal mastoid suture, the occipital mastoid suture, and the lambdoid suture. The infratemporal fossa is continued below with the zygomatic arch. The anterior posterior wall of the infratemporal fossa is formed from the surface of the maxilla. The medial wall of the infratemporal fossa is formed by the lateral pterygoid plate. The lateral wall of the infratemporal fossa is formed by the ramus of the mandible. The roof of the infratemporal fossa is formed by the greater wing of the sphenoid.